I would now like to call Rameen Fatma from Beacon House School System, Islamabad, to deliver her speech.
Respected Ma'am Sadia Rashid, President Hamdard Pakistan, honorable representatives of World Health Organization, dear participants and guests, Assalamu alaikum. First of all, I would like to thank you for inviting us to express our views on today's topic, building a fairer, healthier world. Please allow me to start my speech with verse number 11 of Surah Araf of the Quran, whereby Allah Subhanahu wa Ta'ala tells us, truly, Allah does not change the condition of people until they change what is in themselves. It is also very relevant to recall sub-article D of Article 38 of the Constitution of Pakistan that stipulates the state to provide the basic necessities of life such as food, clothing, housing, education and medical relief to all citizens irrespective of their gender, caste, creed or race. From these two references, it becomes very clear that where the state is mandated to provide us with the basic necessities of life, the creator of the universe holds all, including the public and masses, to be responsible for improving and changing their conditions. Where we expect the state to provide us with health facilities, we need to understand and realize that the governments alone cannot do much if we as public do not play our part. Healthcare in Pakistan is identified as one of the country's most underperformed sectors. Transparency International in its reports is observing that corruption ranked high as compared to previous years in Pakistan's healthcare sector for the last 20 years. Our healthcare sector is challenged with numerous problems, constraints, and contradictions. But at the same time, we need to acknowledge and understand that in the absence of equitable distribution of health and reluctance on the part of the government to increase the budget on health, these inequalities are to grow many folds and our healthcare system would stand crippled. Now, coming to the details and state of affairs of our country, Pakistan's ever increasing cases of communicable and vaccine preventable diseases brings light to its proud healthcare system. Take the examples of viral hepatitis, dengue, malaria, cholera, typhoid, and HIV laying havoc in the lives of the people. While the rest of the world is free from polio, we, on the other hand, see polio cases surfacing in Pakistan on a daily basis. Pakistan had the world's highest number of polio cases in 2014, and records show that nearly there were 84 polio cases in 2020 only. The medical and paramedical staff at hospitals and clinics complain about the lack of facilities in our healthcare system, and they have a point in saying so. Reason being that it is a fact that their behavior and actions are dependent upon the facilities that are provided to them by the state. Basically, the negligence of the state has increased throughout the years. Here is how. Our constitution refers to health in the most limited manner. Medical relief is the last facility mentioned in Article 38 under the unenforceable principles of policy and is not recognized as a basic human right in Pakistan. For 2020, allocation of rupees 4,000 million for development projects in the healthcare sector speaks a lot about the seriousness of the government towards our healthcare system. Our country's spending on health is less than 1% of its GDP, whereas the World Health Organization recommends an allocation of about 6% at least. As a matter of fact, we all know that much of this is spent on the urban areas, and in the remote areas, there is little or no money left for their improvement, and they need to be actually improved because they are the hub of the diseases. With the arrival of coronavirus, the situation has become even more grave. And this can be gauged from the fact that only 25,000 kits were available for COVID testing in the start of 2020 for a population of approximately 208.57 million. We faced lack of protective gear and PPE kits in the hospitals of Pakistan, resulting in death of almost 100 healthcare workers by the end of 2020. The number of ventilators in our country is currently 393 to deal with 678 cases of COVID-19. In Peshawar, 6 coronavirus patients died after the oxygen supplies ran too low. With the population of 224 million to vaccinate, the Pakistani government is still hoping to get help from other countries around the world, and only 0.8 million people have been vaccinated, which is the lowest in the region. As a society, we have become insensitive. Businessmen have turned everything into a business opportunity instead of helping our fellow brothers and sisters for free in times of this pandemic. The prices of COVID-19 testing kits, Vaccines, medicines, ventilators, and even simple surgical masks has increased to an extent that even a middle class person cannot afford it. Our social and cultural values have contributed largely to the problems of healthcare. The desire of people to be rich and have a high status in the society leads to corruption and unrealistic prices of treatment of common diseases, making it hard for a common man to access these facilities. The protected environment in which the rich bring up their children, making them completely unaware of the problems of the poverty stricken people, gives rise to racism and discrimination. As when these children have the authority to make a change, they choose not to. Because due to everything being presented to them in a silver tray, they are completely uninformed of the harsh realities of the world. This way, the vicious cycle of the rich becoming richer and poor becoming poorer goes on as the needy are further plunged into poverty when paying for care. You would have noticed that most of the people in Pakistan do not even know about the ambulance helpline. Reason being that they do not trust the service and the government machinery. Our health system and policies are framed by politicians having political preferences and priorities, executed through bureaucrats devoid any concern for public and implemented by the health professionals on the ground. The health policies in Pakistan mainly focus on curative healthcare, such as increasing number of health facilities, laboratories, ambulances, and modern equipment to show to the public that something is happening on the ground. While formulating the policies, insight is taken from the success stories of developed countries without considering the ground realities, religious and cultural values, social dimensions, and paying even less attention to the economic differences. With the outbreak of COVID 19, countries have come to realize the importance of healthcare for the well being of the society. It has illustrated that health is not a luxury item. It's the cornerstone of social and economic development and of global health security. Nations, for example, USA, that were hit much harder with COVID 19 than Pakistan, were able to deal with it and accommodate their citizens in a better way just because of a better healthcare budget that was spent in the right places. Building strong, resilient health systems is therefore not only an investment in healthy populations, but it is also an investment in safer, more stable, and more prosperous societies. With this global disruption comes an immense opportunity to reimagine the world as it could be, to build a healthier, safer, and fairer world. It is a long way to this, but with continuous effort and determination, we can do it together. Starting with ourselves, we need to be more aware of our surroundings and the issues of a common man. We must not treat the lower class harshly and think of them as inferior. Instead, we should consider it our duty and their right to share our wealth with them in the form of money, food, water, clothes, medicine, and even knowledge so that they can have a better life. Moreover, it is high time for us to stop keeping our younger generation in the dark and inculcate a sense of brotherhood and humanity in them. It is time for us to break free from the old social norms and abolish the gender stereotypes. Before differentiating among people on the basis of their race, color, gender, and status, we must see everybody as a human and provide them the due respect. As a society, we should urge the government to bring anti racism and anti sexism laws to promote equality among us. Hospitals and clinics should be decentralized, and the authorities in the provinces and districts should be allowed to deal with healthcare as they are more aware of the obstacles in their work. Furthermore, the concept of prevention is better than cure should be promoted, which is not only helpful in the ongoing pandemic in the form of following SOPs, but it is also very helpful in controlling other common yet fatal diseases like that of heart, lungs, etc. Food drives to counter the problem of malnutrition and providing free medical assistance to people all over the country is necessary if we want to overcome the problems of poverty. I would like to end with a famous saying of Barack Obama: the change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. As being a citizen of Pakistan, it is my responsibility to take action on the ongoing issues in my country because I believe that a change in Pakistan will inspire the world. And then together, even though slowly but steadily, we will move towards a fairer and healthier world. Thank you.
Inshallah. Thank you, Ramin Fatma. Rehabilitation is the core health strategy that optimizes individual, social, physical, and mental functioning in everyday life. The ultimate goal of rehabilitation is full participation and inclusion in society. In this statement, we highlight that improving the health status of a population does not only mean reducing mortality and morbidity, but also ensuring that people live, function, and participate at their best potential.